I'm the current president of the Lyme Disease Association of Australia, and it's my great pleasure to offer you this education about Lyme disease in Australia as it stands now. So the first thing to talk about is what it is. So Lyme disease is an infectious illness. It's by definition caused by the bacteria from the genus Borrelia. It's also known as Lyme borreliosis, and typically it's the strain called Borrelia burgdorferi. It's been isolated on every continent in the world, and it's one of the fastest growing vector-borne illnesses globally. It was originally named after the U.S. city in which it was first isolated, which was Lyme, Connecticut. It's transmitted by a blood sucking vector. Right now, it's mostly thought to be ticks, but there is emerging evidence showing other vectors as well. And these ticks feed on a host that is infected, and then they can transmit that infection through to humans through a secondary bite. Global perspective, is the biggest concern about Lyme disease is then vector-borne disease. Is the World Health Organization is saying it's both preventable and treatable for the most part. Lyme is the fastest growing vector-borne disease in the US. Up to 300 strains of Borrelia are reported globally and over 100 in the US at this point. In 2014, they added Lyme disease as an indicator of climate change in the US. And most recently, the Australian Medical Association has talked about emerging vector-borne diseases as part of climate change as well. And so has the World Health Organization. The incidence in Germany is estimated to be 60 to 100,000 new cases annually. The other thing to be aware about is that birds can be hosts for ticks. So anywhere birds can fly, logically, Lyme disease could be found. Borrelia has even been found in seabirds in the Antarctic, as one example. A 2015 Californian study showed 57 out of 100 birds with ticks on them testing positive for Borrelia. And as I mentioned before, other vectors are suspected. You know, we have anecdotal evidence of people suspecting fleas, mites, mosquitoes, march flies, and even leeches in some instances. So what about Australia? In Australia, the Lyme disease has been diagnosed in every state so far, and it's in city areas and bush alike. Over 1,200 medically confirmed cases have been reported to the Lyme Disease Association. Australians are infected anywhere. They can occur at any time of the year. And in our 2012 survey showed that 70% of respondents do not remember a tick bite, and 25% of those people had never left the country. The controversy, well, that's a good question, but ultimately, evidence of Australian Indigenous or locally acquired Lyme has been published. You can see the list of studies there between 1959 and 1998. But there was a study in 1994 to 95 that denied Lyme. They studied a large amount of ticks and they said they could not find Borrelia. They did indicate that they had spirochetal artifacts, but no further steps were taken to identify that. And the other thing is that they only looked for approximately 3. I've heard one, but from one researcher told me, and another one has indicated that 3 North American strains of Borrelia were looked for. And ultimately, in today's age, science has progressed, and there's now 100 known strains. So, you know, we dispute that this is an adequate study to deny the evidence of Lyme in Australia. In 2012, a couple of the state health ministers asked asked the chief medical officer to take leadership on Lyme disease in Australia, and he set up a clinical advisory committee on Lyme disease. It wrapped up in 2014 with some progress. And as part of his concluding statements, Professor Bagley, he asserted that there is a Lyme-like illness in Australia, that people are getting sick after tick bites here. He commits to addressing blood testing inconsistencies. He outlined research priorities, but to date, there's been no budgetary support or prioritization of that. And he committed to a tick bite awareness and prevention campaign in conjunction with the health officers of state and territories. So while this is progress, and we highly commend and are incredibly grateful, obviously for people sick now, it's falling dramatically short of sick patients' need at this point. Now, the other thing that our research as part of the clinical advisory committee process showed was that the patient research or the lab testing in Australia showed inconsistencies. So, you know, there's some details here between Westmead and POMS, and they're ultimately, to simplify it, they were testing for different strains, and they also would use different criteria for a positive. So one needed 5 bands to be positive, another 3. So the bottom line is, if I sent my blood to both of these labs, we'd be getting discordant results. So the government has committed to uh, discovering a solution for that. Putting it into perspective, so you can look here, the incidence of West Nile, HIV, breast cancer, and Lyme. So what's wrong with this picture? We'd like to say that incidence, we have no reason to believe it will be any different here. And think about all the recognition those other diseases get. Do you ever hear anything except, negative things or crazy patients when it comes to Lyme disease? And breast cancer and HIV, they have so much funding and support. Many Lyme patients say, gee, I wish I had cancer. I could get care support, I'd get recognition, I'd get funding from the government, I'd get my superannuation release, and many of these things are being denied to Lyme patients who are sick right now in Australia. The prevalence, well, ultimately you can't find what you're not looking for. There are no government statistics on the number of Lyme disease in Australia because locally acquired Lyme disease is currently not recognized. Our 2012 survey just had under 300 respondents. 2013 had over 800, and 2014, due to time constraints, we're just doing a simple online map survey, and we have over 1,200 now. And that's a very small reach. We consider that we'd be the same as the US. So if you extrapolate that per capita, we'd be around 18,000 new cases in Australia per year. And because of the current question around locally acquired Lyme disease, most of those obviously are undiagnosed or misdiagnosed as something else. So this is a picture of early mapping so you can see there really isn't anywhere that's immune. So these are homes with diagnosed cases of a patient diagnosed with Lyme disease. The early Lyme disease symptoms, and that's why it's tricky. I got bit in 2002 and I had a bullseye rash like this on my arm, but I didn't know what the significant ones. And over the next 3 years, I got very sick. And if my doctor had been, aware or been trained or had been notified that they should be looking out for symptoms of Lyme disease here, and when I got sick, they would have asked me if I had a tick bite history. It would have changed the last 12 years of my life. Now, initially, it's also very they're just any kind of symptoms, flu-like fever, headaches, just often like a cold or a flu. But if there was, they're not always as a rash. Only 35% of our patient studies showed that they had a bullseye rash, and this particular rash is actually diagnostic of a Borrelia burgdorferi infection. So these people have Lyme disease. If they have that rash, even if no symptoms, they need 3 months of treatment with 2-pronged antibiotics. Now, late Lyme disease is very dire. The bacteria can quickly spread within hours into tissues and organs. It can be out of the blood, and thus the difficulty with blood testing. Lyme can mimic many diseases, including multiple sclerosis, rheumatoid arthritis, Alzheimer's, motor neuron, Lou Gehrig, Parkinson's, lupus, chronic fatigue, sarcoidosis, ADD, autism, and more. And ultimately, I would assert that anybody with those diagnoses should really be reassessed in Australia, including Lyme as part of the differential diagnosis. It may not be, but they deserve, if it is, then there's a different treatment protocol for them, isn't it? I had an Alzheimer's diagnosis in my 40s, and that wasn't true for me. I have 70% recovered with treatment. Now, Lyme disease symptoms, early symptoms, like I've said, are flu-like, and they can be rapid or slow, and they can be delayed, which further complicates it for doctors. Late lists are extreme, and ultimately it could be anything. And that one of the challenges for doctors is that they're often changing. They can go from pain in one side and complain in a completely different place. Their symptoms jump all over the place, and they're not really like any other disease that doctors would be used to evaluating for. And the other thing, some patients, and quite a lot in the media, they end up showing patients who have visual signs of being sick, because obviously that's helpful in visual media. But the bottom line is that the majority of Lyme patients, you can't tell they're sick by looking at them. It's an invisible illness, and inside they're living a tortured and very disabled life. The other complicating factor, again, for doctors and patients, is that it's more than just Borrelia. So typically, I know Dr. Horowitz is a world-leading Lyme literate doctor, and he says he's never seen a patient with a single causative agent causing their infection. So it's most typically always a cocktail, and any one of these and more that are indicated here. There's been 3 brand new, I think 4 now, brand new tick-borne diseases discovered this year that have never been discovered before. Understandably, this for doctors and patients, it causes a very varied and complex presentation. And with a cocktail of infection like this, the immune system is often overwhelmed very quickly. So, and also the symptoms are completely dependent on the patient. They can be mild, moderate to severe. They can be intermittent. And each of these infections listed here require different kinds of treatment and also different order of priority of treatment, which again further complicates that for patients and doctors. It's tricky to diagnose, obviously, for the reasons we've already said, but it's also tricky to treat. Challenges with blood tests, we've talked about that. So it's just not a straightforward situation on any level, whether that's government, patients, or doctors. Early treatment for Lyme disease should be 6 to 12 weeks, and it should persist beyond symptoms. So if they're still having symptoms, they require treatment, and they need more than one antibiotic approach. It's not a simple approach. For late Lyme disease, treatment is a marathon. It requires a combination of therapies. They need to have a combination of things to treat the infections, and also to support the organisms, support the body. The body gets very sick and overwhelmed and toxic, and there's often a very integrative approach required for successful treatment. The other thing that you notice there, that left untreated, Lyme disease can be fatal, and it also causes severe depression. So unfortunately, suicide is often the choice of many chronically ill and unrecognized Lyme patients in Australia. And actually we call it self-euthanizing, because it's just such a torturous experience. So, yes, they choose suicide, but it's out of desperation and due to the symptoms of the disease. Now, our survey in 2012 also showed some other disturbing facts. Over 50% of people traveled more than 50 kilometers for treatment. 9% of those were overseas, and that, if we did it this year, it would be completely changed. I'm sure you've seen the media coverage of all the patients traveling to Germany for treatment because they're unable to get treatment here. That's 2014, 130, and that's continued to patients. Many patients have gone in 2015 as well. Approximately 70% have had to take time off work or school, and 50% have had to quit their jobs. 38% reporting having suicidal thoughts. And sadly, these common themes are reported. They've got a significant decline in the quality of their life. They've got gross deficits in their ability to function, increasing social isolation, and they're often rejected by their peers, their friends, and their family, and extreme financial devastation. I'm talking to people every day where they've just lost everything. So, and the other thing is, this is a US study from LymeDisease.org showing quality of life as to compared to other diseases that we know more commonly known. So you can see this is the general population: asthma, depression, MS, diabetes, fibromyalgia, chronic fatigue, and then Lyme disease is 72% of report low quality of severity, 72% severity of quality of life. So that's just shocking. You just don't want to be walking in these patients' shoes. There is some good news, though. So the greatest news is that Lyme patients do get better when treated. When I mentioned at the beginning, with treatment, I'm 70% of who I used to be. But without treatment, I was laying on the couch praying to die every day. It was very severe, and I would never want to go back there. It's indescribable, really. So if someone, what's important for you to know, if you or someone has symptoms following a tick bite, seek informed assessment. You might have to be persistent and understand that most physicians are not trained about Lyme disease or tick-borne disease. They have no treatment, and they ultimately have no backing from their peers either. If you have one of the diseases that Lyme disease can mimic, again, persistently seek support to be reevaluated to include Lyme as part of that differential diagnosis. You need to seek peer support. As a witness to Lyme disease patients over the past 2.5 years, one of the most significant factors in successful rehabilitation to a new life is peer support. And obviously, we all need to advocate for and support the sick members of our community. Really listen to them, believe, understand, study, research, learn what Lyme disease does and invisible illness does, how it impacts people. Now, preventing Lyme disease, ultimately be tick and vector smart. Be aware of ticks when you're out. Use some of the things that you see here. So wearing a hat, light clothing, pants tucked in, DEET or permethrin repellent on clothes. There's some great clothes now that have, I've been getting very positive, for people that work outside, getting very positive reports back about their ability to repel ticks. Checking your body for ticks afterwards, drying clothes in a hot dryer for 10 to 30 minutes after exposure to tick-prone areas, because they can survive on your clothing and then get onto you at a later time. Do not put anything on an attached tick prior to removal. I know there has been some recent media talking about freezing ticks, and we've done a research analysis. We can't find any evidence. The only evidence that research shows is that a stressed tick injects more saliva. So the best way to protect yourself from Lyme disease is to get the tick out as quickly as possible, and remove it very close to the skin, and without squeezing the body of tick. And then obviously with any symptoms, seek informed and trained treatment. Now, more tips on preventing. Be Lyme disease savvy. Understand that not all medical professionals are Lyme aware. Again, I can't, it's repeated here, but it's for a reason. Be persistent if you're concerned. Don't stop at the first person who says there's nothing wrong with you. And the other thing is, there's no one doctor that's right for every patient. You need to find a match for you, and that may include seeking overseas consultation at this point, because we've only got a handful of doctors nationally. Understand that blood testing is not reliable, and that a negative blood test does not mean that it's not Lyme disease, and that's international best practice. The majority of people are misdiagnosed with another disease first, so many Lyme disease patients have multiple labels by the time they come to see and evaluate themselves for Lyme disease. Always treat if there are symptoms after a tick bite. There are varied medical opinions on treating prophylactomy or treating after a tick bite with no symptoms, but that's something to be discussed with your medical professional. The sooner you start treatment, the better the outcomes will be for you. And do not stop treatment when you've got active symptoms persisting. And I guess the most important thing is to pass this education on. So about us, we're the Lyme Disease Association. We are all volunteers, either sick, about 70% of us, 75% of us have Lyme disease ourselves, and the rest are carers of Lyme disease patients. We lobby to support the government and public in understanding more about Lyme disease, advocate for early diagnosis and treatment, liaise and fundraise for education for doctors and allied health professionals. Hopefully you've been around for one of our May Lyme projects, and so many, I think we've had 20,000 brochures go out this year, so that's a lot of awareness going out into the Australian community. And we do our best to facilitate improvements in quality of life for people living with Lyme disease. So you can help spread the word. Let people know. If you know someone who's got sick after a tick bite or has a history, pass on our details, and we'll do our very best to get them supported. So I want to thank you for taking this time to listen to our story, to learn more about Lyme disease. And Lyme awareness truly does save lives. Every time I do an awareness event, there's someone who said, thank you, thank you, thank you. God sent you to us to help me along my path. So thank you very much. Thank you for listening, and please, you know where we are. Contact us at any time.